Hey, my name is Luke Schellenberger. I'm an ENT doc. So, you might have seen prior videos. They've been all shot in my kitchen. I moved into the clinic and I'm going to do a few videos here. One I want to talk about is about dental devices for snoring and sleep apnea. And so, when patients have sleep apnea, the biggest issue is that these muscles that attach all through our mouth and throat relax when we sleep. And when we lie down, they fall to the back of our throat. And so they cut off our airway. When airflow is fast, it causes more vibration of surrounding tissues. When it's slow, it causes less vibration. And so there's different ways that we treat sleep apnea, but one way is to refer them to a sleep dentist. And there's different sleep doctors that I work with and refer to here in Mansfield and also up in Arlington. And they create what's called a mandibular advancement device. And that's what this little thing looks like, okay? So this is on a model. There you go. And one of the local sleep dentists let me get this to show it to patients. But basically they create a little, what looks like an upper and lower retainer. I'm gonna take this out, my friendly little toothy bear guy. And so it's got a top part, let me kind of hold these from the back, got a top part and a bottom part, and both of them have these little ridges. And what happens is the lower ridge interconnects with the upper ridge, and what it does is it brings your lower teeth ever so slightly forward. Well, you can see all these muscles would attach to that lower jaw. When you bring the lower teeth and the lower jaw ever so slightly forward, it brings the base of the tongue and the structures attached and around the base of the tongue forward as well. And so creation of more a larger airflow space allows that flow to be more smooth, and it causes less vibration, so less snoring, but it also causes less obstruction, less collapse, and so it also improves sleep apnea. And so dental devices have come a long way in the last 20 years, and I'm a big fan of them for certain patients who have sleep apnea. And so if you come and see me, that may be something that we talk about. So mandibular advancement device is a very good option for a lot of patients who have sleep apnea and with snoring. All right.